Hello, I'm Dr. Chen, the professor of West China Hospital of Stomatology at Sichuan University. External apical root resorption is an inevitable side effect of orthodontic treatment from clinical experience of these years. We found more root resorption could be observed in older people as many studies indicated. However, physiological age was unable to accurately reflect root development, which was more likely to associate with root resorption. So we asked ourselves, if there is less resorption of incompletely developed roots compared with those that were fully developed during the same orthodontic treatment. We selected a sample of 524 patients aged from 10 to 15 years following the inclusion and exclusion criteria. For each subject, digital panoramic and natural radiographs were connected before and after treatment. Then the included case were further divided into an immature tooth group and a mature tooth group, according to the formation of all maxillary central incisors apex, both before and after treatment. Through calculations, we found that the amount of root resorption can be assessed by a accurate and scientific approach for large-scale application using radiographs. It needed only 8 measurement index to obtain the amount of root resorption for each patient. The basic information and treatment parameters regarded as possible risk factors were also connected and compared. There was a statistically significant difference in the amount of root resorption with tooth development before correction as well as after correction, indicating that the immature tooth group has less root resorption. The pre-treatment and post-treatment root lengths in the single group were also compared, showing that an immature tooth will suffer little real root shortening but not be stunted. In linear univariate and multivariate regression analysis, tooth development and other 4 risk factors were included in the final model for root resorption, and tooth development had the highest beta value. In conclusion, there is an association between root resorption and tooth development, and tooth development is an important predictor of root resorption. Patients with immature teeth are at a much lower risk of apical root resorption. How tooth development affects root resorption has yet to be determined. We speculated that the less root resorption in the immature tooth group may result from the effects of some cells, moleculars, or signaling pathways in repairing and inhibiting root resorption. So we are conducting further studies to explore the mechanisms. Thanks.